Hello. Today we're going to talk about the most commonly asked question in healthcare by common mwananchi, whereby 50 to 60% of the women are experiencing. So this video is to remove all the ignorances that are there about UTI or any misunderstanding that your man might have given you UTI. So let's listen. We get UTI in both men and female, so it doesn't mean that it's only female who can get UTI or urinary tract infection. So what is UTI? A UTI is any infection that is affecting any part of the urinary tract system. May it be urethra, bladder, ureters, or kidney. So it means that it is an ascending infection. What causes UTI? Is a bacteria that is found in the gut, majorly is found in the gut, called E. coli. So that bacteria, when it gets in, or it comes into contact with the part of the urinary system, it ascends, affecting you. So that is what is called UTI. So now you know that it's not a sexually contact, but sex can contribute to an ascending infection of the E. coli, of that bacteria. So how do we get UTI? Number one, bacteria transfer. As we said, it can come from the gut. So when you're going along with your long haul, you might find that when you wipe from back to the front, you might come into contact with that bacteria. So that's why we are saying that bacteria transfer can cause. So another thing that can cause UTI is other factors like dehydration. You're not hydrating enough, so the urine becomes too much concentrated, and any bacteria that is trying to be flushed out of the body can infect you. So then holding in urine for too long can also contribute. Wearing too tight and unbreathable clothes can also contribute to you getting a UTI. Also, as we said, sexual activity can contribute. And what do I mean by this? Because the vaginal opening and the urethral opening for women are too close, so when you're coming into contact with your man, it's called honeymoon cystitis. When you're coming into contact with your man, that bacteria might ascend. So it's good to urinate immediately after a sexual intercourse. Also, what other factors can contribute? Douching. When you're using a lot of soap down there, female, we all know this, you're wiping your gut flora with chemical soaps. So don't use soaps down there. Okay? So what are the signs and symptoms of UTI? Burning sensation. A patient will come telling you, oh, I have been experiencing burning sensation when I urinate. What can I do? Or have my man affected me? No, darling, they have not affected you. Okay? So what else? Frequent urge to urinate is there. You find that you're urinating so much because it causes an inflammation of the bladder. Hence, the urge to keep on urinating, and when you urinate, you find that you have voided your bladder, but it is still feel like there's some urine that has remained right in the bladder. So you'll have that post-voidal, it's called post-voidal feeling. Then you will also have foul-smelling urine, which might be cloudy. And also you might have low abdominal pain. Some people may feel the pressure in the lower abdomen, others it's a dull ache pain or a pelvic back pain. So you might find that. So another thing, what are possible complications? What are possible complications of UTI? If left untreated, it can ascend to the bladder and to the kidneys. So ensure that it gets treated. So number two, other complication, once it ascends and it gets to the bladder, you can get something called pyelonephritis. That is not to the kidney. You can get something called pyelonephritis, and you find that it has inflamed. So with that, you have to always make sure that you have been diagnosed properly and you've been given the right medication. If you're not sure about the medication you're being given, is according to the factors that we said. Stay hydrated, that is number 1. Always urinate after sexual activity so that the honeymoon cystitis does not get you. Wipe properly, wear breathable underwears, and also ensure that you avoid holding urine. And use clean clothing, clean toilets, okay? So quick recap, what is UTI? What are the causes of UTI? What are the complications of UTI? And how do we prevent UTIs? So find us in mobile, Dr. Kenya, they are at WhatsApp. It's a public channel, so for more information for your prescriptions guidance. Thank you.